On today's how-to segment, we're going to review how to use a TENS unit correctly. There's a lot of TENS units out there. Some of them get very complex. I like to keep them simple in our office, so I chose to use this one from Roscoe Medical. It's a TENS 3000. It's very simple, very easy to learn how to use. For TENS units, there's three basic things you want to look at: the pulse width, the pulse rate, and then the mode. So let's look at the mode first. So for this example, we're going to look at someone with general cervical pain. So for that person, when you look at the modes, which is right up here at the top, there are three settings. It would be normal, burst, or modulated. For somebody with that acute pain, you would put it on the normal setting. That's done for someone in the acute phase. The second thing you will look at is the pulse rate. That is the number of electrical bursts that occur per second. Again, for this patient, we would put that on, you'd want it to be anywhere between 80 to 100. So we're going to set it right at 100 for that. So that's this button over here on the right. The next thing you will look at is the pulse width. Again, for this patient, I would also set that at 100, and that would be just like that. So those are the three things that you'd want to do to set up this TENS unit. Pretty simple to do. With these TENS units, most of them run on a 9-volt battery, which you could buy at the store, and that's what that looked like. Some of them allow you to plug them in as well. And the only other thing you would look at is the time, how long you'd want to use it, and then how many times per day you want to use it. Generally, for the acute patient, you would want to do it between 2 and 4 times daily. Now, and then you could also, in the acute patient, you should use it at about 20 minutes for each time, and stay somewhere in that range. We do have on DirecTENS.com, we have a TENS guide, which could take you through numerous body parts, different injuries, and how you would set up the TENS unit specifically for those injuries. So what you would do is go to DirecTENS.com, you would go to Patient Resources, and then TENS Guide, and that guide could walk you through how to use it in almost any injury. So from here, let's go take a look at a patient and see how to actually place the TENS unit and the electrodes on the patient. Here we go. Okay, for this example, we're going to assume this is a person that has a neck sprain strain or whiplash injury, which is general neck pain. So what you want to do first is first make sure that their skin is clean. I just usually use one of these alcohol swabs to do that, and just clean off just to make sure there's no oil or lotion that's on there, just so that conductivity is a little better. And then what we're going to try to do first is just find the central position where the pain is most generated from. So for this example, we'll just assume that the central point of pain is right in here. So what you want to try to do from there is you're going to create an X pattern over that point. So here's what we will do. So when you have your TENS unit, you're going to take 2 of the pads from the same lead, and we'll call them 1A and 1B. So you're going to put 1A up here on this part of the X, on the upper left portion, and then you're going to put 1B on the lower part of the X down here. Then with the second leads, you're going to do the opposite. You're going to put 1B up here, and then, 2A up here, and 2B down here. So what you're going to do is you're basically creating an X pattern through that centralized point of pain, which is right there. For this example, we're going to again assume with the neck pain, so we're going to set the TENS unit to the pulse rate at 100 and the pulse width at also 100, and you're going to bring these pads up to the patient's tolerance. You'll notice after some period they'll get used to that, and you could probably take it up a little higher. Now, if you're using this at home, just be aware they are home units, so you won't injure yourself by doing this. If the pad placement is a little off, it's not going to cause any problems.